Hello, welcome to Acupuncture for Fertility Unlocking the Benefits. My name is Monica. I am the marketing specialist for Inception, and we are excited to have you join us for this special webinar where we'll explore how acupuncture can support your fertility journey. Our presenters bring a wealth of experience and a deep passion for patient care. Together, Sabrina and Dr. Domar will share their knowledge, blending science and empathy to help you discover the transformative benefits of acupuncture for fertility. Let's get started. So starting with Dr. Ali Domar, she is our Chief Compassion Officer at Inception Fertility. Dr. Domar has dedicated her career to supporting patients through the psychology and emotional aspects of infertility, providing guidance that transforms lives.
Thank you, Monica. So yeah, I'm Ali Domar. I've been doing these webinars almost every month for the last 2.5 years. So probably a few of you know me. So Sabrina, I actually think if you have a degree in Oriental medicine, are you considered Dr. Pseudo? Can I call you Dr. Pseudo, or is that not appropriate?
It's a doctor of acupuncture,
Okay.
yes, and
So
it's a diploma. Yeah.
So Dr. Pseudo is a registered acupuncturist in Alberta, Canada, and she's been in clinical practice for over 22 years and is actually our lead affiliated care provider on site at our PCRM clinic in Edmonton for the last 2 years. She's experienced her own secondary infertility struggles and a miscarriage. She's a wife and she now has two healthy children who are 11 and 4. So that's what we consider a short and sweet introduction. So
Hmm.
the plan for tonight is Dr. Sudo has prepared a PowerPoint to explain the physiology of acupuncture and how it might support infertility or support fertility. I personally know a lot about acupuncture because I've done research and I was the director of an integrative care center for 20 years and employed 6 acupuncturists, and I have a lot of clinical experience with it as a patient for back pain. This is mostly at the beginning going to be solid information from Dr. Sudo with a little bit of commentary from me. So please, Dr. Sudo.
Okay, thanks, Ali. That was beautiful. It shows that you've done many of these over the couple of years. And
Yeah.
yeah, so today we are going to talk about obviously fertility and acupuncture. But I've set this up in a way that educates the patient, the practitioner, but also the partner, just on holistically what Chinese medicine looks for when we're trying to support you. Of course, there are evidence-based pieces that we're always following protocol on. But if we can follow the breadcrumbs a little bit more, then we can take a look holistically at what else we can do to just contribute to optimal fertility and hormone production. So, Monica, I'll get you to head on over to the next slide. Okay. So these are systems that some of us might be familiar with, but it's really important to understand that there is often a cascade effect. So when you're looking for fertility support, we are often looking at hormonal support, blood tests, and sperm analysis. However, based on Western medicine and Chinese medicine, there are other systems at play that can lead us up to certain imbalances. Sometimes they're genetic, which we don't really have a lot of say in, and there are other things with fertility that we don't have control in, but there are certain areas, if we take a look at, it not only helps support the fertility system, but everything else, so you're feeling at your best. So I know many of us have heard about stress, but really we're taking a look at the nervous system. And so we're going to break down all of these systems a little bit more pertaining to Chinese medicine and Western medicine. So stress would be the nervous system. The circulatory system is another one that's really affected in fertility. and then the lymphatic system. So the lymphatic and the immune system are interrelated just for purposes here. And then the endocrine system. So of course we have the reproductive and endocrine, but we're going to break down each four of these systems to take a look at, okay, what else can I do? And how else can acupuncture perhaps support me on my journey? So Allie, anything to add with just this little introduction or breakdown?
Nope, way out of my depth. It's all you.
Okay, fantastic. So Monica, I'll get you to cruise on over to the next one. Okay, so acupuncture and the nervous system. So many people have heard that acupuncture can be good for stress. There is a lot of evidence now that can show that touch, acupuncture itself, getting out in nature can help support the nervous system. We know this, but when we start watering it down, some of the research shows that acupuncture can help raise your serotonin levels, your endorphin levels, and sometimes dopamine levels. So there's two pieces to this. When we're in a state of stress, and oftentimes stress does not look like we are in a state of emotional distress. It can just be a state of tension that we're always in. We're always thinking, we're always planning ahead. We're trying to figure out, what do I need to do to fix this problem? And sometimes we know, and many people know, that we're not always the ones that need to fix it. But when the nervous system can get into a more relaxed state, we're able to see perhaps all possibilities. Like, hey, maybe I do need to sit down with a psychologist. Maybe I do need a week off of work. Maybe I do need to adjust my diet a little bit. And when you're in that fight or flight state, it's very hard to conceptualize what to do next. So, it's been shown, of course, to help with insomnia, depression, anxiety, and just overall tension. And so in general, acupuncture has come quite a long way as far as the techniques go, where we're not using really thick and abrasive needles. We're using really gentle techniques that don't put you in a further fight or flight and scenario. So if you're seeing an acupuncturist right now, you really want to also communicate with them and let them know just to start slow so you can get acclimatized to what the sensations are. Most people, if they're really a talented and skillful acupuncturist, right away within the first few points, you will be at ease. And even on an initial appointment, perhaps you've just chosen to use acupuncture for a fertility transfer on site or off site, even meeting them just that one time, they should be able to help your body go into that state of rest where you almost feel a little bit sleepy. And so in this space, oftentimes we think of just using the acupuncture, but a really skilled practitioner will also have a communication style with you. Not necessarily a counseling style, but a curiosity and a discovery style where you're in communication about where life is for you, what your day looks like. And in traditional cultures, especially indigenous and Chinese medicine cultures, the way of communicating is storytelling. And storytelling seems to land a lot more for people than just giving us straight facts when we are in a treatment setting. So I myself like to use things that are relatable for people, just like we would do in a movie. When we're watching movies, they tend to elicit certain responses in the body, excitement, pondering life circumstances, and a skilled practitioner should not only just be providing acupuncture for you, but they should be in conversation with you. And the storytelling aspect of getting you reconnected back to yourself, again, similar to what a movie would do, is really key. So on this slide here, one of the basic things, and we're not going to go in too much detail as far as supplements at all or nutraceuticals, but B vitamins do have a really healthy place. So oftentimes we'll see that there are many fertility supplements to take, and we don't really know why or how. Maybe we Google them often, but this will show you a little bit of a breakdown. So there's more understanding as to why you might take certain supplements. So the B vitamins help with the stress response. So oftentimes, patients, when looking for some additional support, they might just choose to utilize acupuncture right towards the end of a journey when they're looking at IVF transfers or IUI transfers. But for myself, clinically, I much prefer a patient to at least be looking at care 3 months before or 6 months before. And these are not treatments that you need to get all the time. Sometimes every 3 weeks, a month, as long as perhaps you're doing some take-home work too. But it's enough to help reset where you're at. And it's far more supportive sometimes than just one treatment. So there's a little link there on some of the research that's on the PowerPoint as well. So Ali, for that piece.
Yeah, I have a couple comments. One is there actually is research to show that in people who have mild to moderate depression, that acupuncture is as effective as antidepressant medication. And so this is just something I tell my patients to keep in mind because I'm not ecstatic about people who are trying to get pregnant, who have mild to moderate depression, taking medication unless they really need to. And so I think acupuncture is a really great alternative. And so I do encourage my patients to try acupuncture first before they go on medication. And in terms of the sense of relaxation that one has during acupuncture, I was lucky enough, as I said, to have been the director of an integrative care center, which means I got free acupuncture.
Mhm.
And I've had 5 back surgeries in the last 4 years. And so I've had a lot of back pain. And so I took full advantage of the free acupuncture. And I have to tell you, I've had massages, I've had all kinds of, things. Nothing in my life has ever made me feel as relaxed as a session of acupuncture. And I'm not a big fan of needles. You barely feel them. But every time I had an acupuncture session, I'd be so relaxed and I'd be just dreading hearing the footsteps of the acupuncturist to come back to take out the needles because I just wanted to lie there forever because I felt so good. And when you hear the kind of back pain I've been having, it's a lot to say that's how good I was feeling.
Mm, yeah, thank you for that. That is not the back pain part, of course, Sally. I mean, that's a big journey into itself. But it gives a clinician the perspective of a patient too, especially the footsteps. I like to hear that because I
I didn't want
know
to hear the footsteps. I wanted her to leave me there for hours.
I know. Yeah, that's usually the request.
Yeah.
And of course, every practitioner will have different places that they place these points, just based on what's happening with your system. But oftentimes, the ears are really a go-to area that really do the trick initially, and then of course throughout the body. So, okay, excellent. Okay, thank you, Ali. Monica, we'll move on to the next slide. Okay, so acupuncture and the circulatory system. So in Chinese medicine, our verbiage is a little bit different. It's always a task to try to figure out how to translate basically one system, one language into a language that we already understand. Most patients understand Western medicine and all the details that come with that. But in Chinese medicine, we refer to it as the blood system. So the circulatory and the blood system are really interchangeable. Um, when it comes to research again, it has been shown, acupuncture has been shown to help increase and enhance the blood circulation to certain areas. So the blood is how we receive many of our nutrients. Of course, there are other systems at play there that create a bit of a cascade effect. Of course, your digestive system as well. However, when we're looking at trying to help the body recalibrate itself, the nervous system comes first and the circulatory system is essentially often second. And so, of course, when it comes to fatigue or any tension in the body, it really helps with those pieces, but also just menstrual cramping and blood flow to all the reproductive organs, which seems to help recalibrate perhaps how the we won't say um, egg quality, but it's more so if we look at all of the pieces that are looking to regenerate themselves all the time, just like if you broke a bone or you tore a muscle, the body knows how to regenerate itself. So the more attention we give an area, the easier it is for it to recalibrate itself. So often we're always thinking, massage the neck, the back, the shoulders, and very few people really concentrate on any abdominal work. So that's the beautiful thing about acupuncture is that we're always in the abdomen, taking a look around, um, getting the circulation going, perhaps with massage. But the points there are really effective to reduce inflammation. And so touch is a piece of this. You're not just receiving acupuncture, a needle, someone's not just throwing a needles in you. You're connecting with that practitioner through touch, which is also an additional bonus. So most patients will receive acupuncture just by receiving a few needles if it is a really quick treatment. But again, you should be looking for a practitioner that really incorporates a fair amount of touch prior to placing the points. It's really key to creating a little bit more safety and trust, but also the body just tends to relax. So supplement wise, again, these are things that we all hear about, the omega 3, 6s, and 9s. And beetroot powder is one of my favorites. Of course, we all know beetroots when it comes to beet salads or borscht soups, but there's some excellent beetroot powders out there that and are showing more and more in the industry of nutraceuticals to help really support the circulatory system. And I've used beetroot powder quite often in the clinical practice for many years. So it has a little bit of an anti-inflammatory effect too for pain. And of course, we have our link here. So the heart is the last piece that we'll talk about, but we're going to talk about that piece at the end. However, I do want everyone just to take note of the heart and the circulatory system, and then that'll be a piece we'll come back to.
I
Okay.
have nothing to add.
No, good.
All right, Monica, next slide.
Okay, so acupuncture and the lymphatic system. So in many countries, there is the practice of reproductive immunology. And so there are some advancements in taking a look at what's going on with the immune system comparatively to the reproductive system. In just basic terms, we'll call it the immune system or the lymphatic system. Of course, it's very, very vast. So we're just going to break it down here a little bit more. This system often gets affected when there's strain on the nervous system and the circulatory system. So then, of course, we start popping up with chronic colds, sometimes autoimmune or digestive issues. Hair loss can be a big one. And so there are ways that we can move our lymphatic system. Walking is really the easiest. And some people will use little rebounders as well. But acupuncture, when it's done in a really superficial manner, so we're not going deep into the system, but superficially, just the same as sometimes a fascia massage can do. It has been shown just to help support the immune system in relation to white blood cells. So when we're looking at how does the body help kind of fight off any kind of inflammatory effects, we have to create, again, movement. But a really skilled acupuncturist will not just, pick 8 points and leave it at that are standard. They will know and take a look at you and say, okay, there's, you can always see a little bit of extra swelling in the behind the knees, sometimes in the elbows, just a little bit of extra padding there. And so it really shows that the lymphatic system is clogged. And you don't want to be too aggressive with that in any kind of treatment. So very shallow points will help the system, and especially points along the back where the spine is. And so oftentimes people that choose to use acupuncture that have other signs and symptoms in their body will no longer have those, chronic colds that are always plaguing them, because all those three are being looked after in a skillful way: nervous system, circulatory system, and the lymphatic system. So, you know, at this point, this is not only storytelling and touch from your acupuncturist, but there should be a lot of lifestyle guidance. And so the lifestyle guidance, if you were just to read it on a piece of paper, oftentimes it can sound really basic. But when you are connected to your practitioner and you can kind of sort things out back and forth, the suggestions will tend to mean more. They'll make more sense because there'll be more of an explanation that's pertaining to what's going on in your body. So there should be not only a guidance piece, but now an educational piece where you're not only receiving care, but you're also learning. And I think I've always thought it's very critical for a patient to learn what else is happening within themselves so they can have their own autonomy. And for myself, of course, I've learned about the body through schooling, but my biggest learning has been through observation with patients. And so we can do that with ourselves as well. And Google tends to be a really big go-to now for a lot of people. However, there's just so much conflicting information and it's overwhelm. And so often we're looking for, um, a biased opinion that will make sense for us. But if you find a good practitioner, um, they'll be able to help guide you in a way that makes sense. And you'll also be able to question them on certain things if they just don't quite land for you. So that piece is kind of the third piece. Yes, I'm talking about the lymphatic system, but we also want to look at education. And sometimes this doesn't always happen all in one session, but you should just kind of take note. Are these things happening for me? And those two, famous supplements now, vitamin D has been around for many, many years in the US. It's much easier to get vitamin D than it is in Canada. However, it is something that daily, I would say most medical professionals will recommend. Of course,
Can I
sunshine.
interrupt for a second, Sabrina? Why is vitamin D hard to get in Canada?
Well, vitamin D, so this is it's an interesting story. So you can get vitamin D, but the dosages are very low. So
Hmm.
let's say they're like 1,000 IUs, when in the States, oftentimes they're at 10,000 IU capsules. I've even seen 50,000 IU capsules that you can just get across, you can walk into a health food store. So in Canada, oftentimes it's a practitioner that will suggest how much vitamin D you should be taking, because it's really hard to go into a health food store, pick up a bottle, and you're basically taking a drop and it really doesn't do anything. So that's the discrepancy between both. If you have a practitioner, so that there's not a fear factor when it comes to it, they can help guide you along a little bit more.
Interesting. Okay.
Yeah.
Thank you.
Yeah, it really is interesting. It's yeah, I could talk about that for a long time, but we'll put that over there. And then curcumin. So it's I would say this cooking herb in many cultures has been coming up in the ranks, and you can get it at most health food stores. And these things are not to be taken while you're directly going through a transfer, but prior to any other medications, they're safe. Your body will know if all of a sudden you're burping up curcumin all the time. Maybe it's just not the right fit for you, but they do tend to help just the immune system regulate itself much more. Yeah. So,
Thank
Allie,
you.
anything else you want to add for that?
No, I think we can go to the next slide.
Okay, Monica. Okay, so acupuncture and the endocrine system. So oftentimes this is the place where most patients start, but this should actually be the last place. Acupuncture isn't really just focusing on what's happening reproductively and hormonally. We're taking a look at your symptoms first and foremost, and of course, with women, there's an easy telltale sign about what's happening with your cycle. It always lets us know every month what is working and what's not working. With men, it's a little bit different. Semen analysis, we're not looking under a microscope all the time. So we don't have that kind of feedback. So most people will look at the endocrine system as being a what's on my blood work and what do I need to do to fix this. And if my blood work is okay, perhaps everything is fine. And sometimes that's definitely the case, but we've got two systems that are interchangeable, the endocrine system and the reproductive system. So the endocrine system is all of those glands, and many of them are housed up in the head. So a lot of people think that they're just, it's just the ovaries and the reproductive system, but there are many things in the abdomen. You can see my little chart here, the chest and the head. And so the typical places that acupuncture is known to work in is with erectile dysfunction, PMS symptoms, irregular cycles. It's really one of acupuncture for many years was known for pain, but I would say secondary, it's really known for helping to regulate cycles. So now, of course, there can be other things that can stand in the way. So there's always, obviously, it's needed and wise that you have another your Western practitioner looking after you as well. But this piece is not only looking at calming the nervous system, regulating the blood system, helping to get that smooth flow of the lymphatic system. But this piece tends to be a little bit deeper. And in traditional cultures, especially Chinese medicine, there is again that conversational piece about, what's really important to you. And so the conversations that I tend to have with people, it's not necessarily a cookie cutter scenario. We have to read the room, and oftentimes we can just talk about, what's happening in weather or sports. It doesn't have to be something deep and profound, but the more that you are incorporating touch and communication, um, the more you hear yourself in whatever capacity. Let's say you're asking a lot of questions. Let's say you're really quiet. Let's say you're thinking a lot in your head. The more you hear yourself on a table or sitting with a practitioner, the more you will get information as to, what really is important to you, because the conversations might be just about work all the time. They might be about home life all the time. And they might be about what's happening with fertility, and they might not be with fertility at all. And so those are opportunities too. And for some reason, of course, this piece is not, it's not evidence-based, but oftentimes if someone puts their hand on your shoulder, there's just a feeling of relaxation and safety. It's the same as the abdomen. If when you're working on the abdomen, the body stores so much tension in that space. And through conversation or touch or using acupuncture, you can try to take a look at, what comes up for you. And why these things are important, especially for myself or any skilled practitioner, is that we're not just looking at fertility and conception. We really want you to walk away with um, an understanding, an education piece, a feeling of connection, and a sense of vitality. So wherever the next steps take you, you're at your optimal place. And so the supplement realm that is really well known in the fertility realm is zinc and selenium. So those two, I know many people are given suggestions for males and females. You can get them anywhere. And again, you talk to your practitioner about the dosage. But these are the reasoning behind why we suggest certain supplements. Every supplement takes a look at different systems. And so just keep in mind that acupuncture and the endocrine system isn't where we start, it's almost where we end. Yeah?
Yeah, I'm good.
Okay,
Monica?
Allie, yeah. Monica? Okay. So these are some of the places that a lot of people will look to through Google or asking their health professionals. How does acupuncture affect all of these pieces, the sperm health, the eggs, the hormones? And so we have to also just break it down to the all of those systems we were talking about before. So with sperm health, I think many people have the conception that sperm is different than the rest of the body, but essentially it's another cell, a very specialized cell, but it is very important that it receives the same kind of care that the blood receives, the lymphatic system receives, the nervous system receives. So we just happen to separate it and think that, it's only for reproduction, but it's just showing an extension of what is happening with the rest of the body. And, advancements are coming along as far as testing goes. But you want to, when you're looking at your overall health, you don't just want to look at, well, what is the sperm analysis saying? You want to take a look at, okay, what is happening in my whole system? And if there are some things that are out of place, more likely than not, they may affect your sperm analysis as well. Okay. And so it has, acupuncture has been shown to help just improve concentration and motility. Egg quality, it's more so about the blood flow that's coming to the eggs than anything else. Of course, PMS symptoms, those cycle irregularities, and then with transfers, acupuncture, of course, is well known for supporting patients that are going through IVF or IUI transfers. And some people choose to only receive acupuncture at those times. I do things a little bit differently. I really, when I'm off site, I really don't like patients driving to see me, then driving to the clinic, and then driving all the way back. It just seems very counterintuitive. So oftentimes it's either a pre-transfer or post-transfer acupuncture. Um, and so even in that place, there have been, many studies that show that laughter Medical clowning is very supportive. In the treatment room on site, patients are very different than they are at a fertility clinic than they are at a private clinic. So often I even use a weighted blanket. I think the weighted blanket, a tiny little piece, just placed on the chest, can be enough pressure just to really help a patient relax. And I think, I'm hoping, one day that can be used at many fertility clinics too. Very simple approach, but really effective. And then the music that's used, I have a little bit of a different style that I use a different type of music that has a little bit of a different beat, not just relaxation, but gets the body excited. With transfers, there's a piece of this that we're trying to also mimic intimacy. And with intimacy, we're not always resting and relaxed and sleeping. There's some excitement to that too. So the music piece is helps someone kind of get into the state of like, okay, yeah, we got this. So with these four pieces is what it's well known for, acupuncture and fertility. But if you take a look at all of the other pieces combined together, every treatment just means that much more. Ali, what are anything you want to add?
Yeah, so now my nerd hat is coming on because, as I said before, I'm the director of research at Inception. So just a couple of things just to actually emphasize what you said. Yeah, there have actually been a number of studies now, randomized controlled studies, which are my favorite kind of studies, that have shown that acupuncture can actually improve sperm quality, motility, morphology, etc. And when I ran the integrative care center, we tried really hard to recruit male patients or patients with male factor to come in for acupuncture, because we thought if they came in for acupuncture that they might be able to achieve a natural pregnancy as their sperm quality improved. And the men were so convinced that the needles were going to go into their penis or testicles that it was very hard to convince them to come in. And so we really never had a large male following. But our acupuncturist swore up and down that the needles were going to be nowhere near the men's genitalia. That's not where the needles would go. So if you have a husband with a partner with a male factor, or you yourself have a male factor, I actually would seriously consider trying acupuncture because the research is actually relatively solid. In terms of, IVF, the pre and post. So the history is in 2002, a study was published by a researcher named Paulus in Germany, who had done this really cool study where he recruited a couple, I think 166 women who were about to have their embryo transfer, and half of them received 25 minutes of acupuncture before and 25 minutes of acupuncture after their embryo transfer. And the other half of the women were randomized to just lie quietly for the same period of time. The women who got the acupuncture had a 41% pregnancy rate, and the women who did not get acupuncture had a 26% pregnancy rate. That's a big difference. And like the world exploded. Like you couldn't find a clinic that wasn't offering some form of acupuncture for years and years and years and years. However, probably since then there have been, I'm guessing, at least 100 randomized controlled trials that have wanted to show that acupuncture, in fact, can increase the pregnancy rates of IVF. But about half the studies have shown, yeah, in fact, women who get acupuncture pre and post have higher pregnancy rates, and half the studies, including mine, show there are no differences. And so how can that be? Well, I think the reason it can be is that Paulus only included women who had good quality embryos. And I suspect, certainly in the study that I did, that the women who volunteered to be in my study were poorer prognosis patients. They were older, they had poor embryo quality, and there's nothing that anyone can do for half an hour before an embryo transfer if you're transferring an abnormal or unhealthy embryo. And so I think the ultimate study that needs to be done, and I've tried to get funding now for about 10 years, is to do the same study that Paulus did, but only include women's transfers who had PGT done. And so that we know that the embryo is chromosomally normal. And that will be the ultimate test, that if we can prove that that doing acupuncture before and after a PGT transfer improves pregnancy rates, then I think we can universally recommend acupuncture for everybody. I personally, as a psychologist, as a scientist, as a former head of integrative care, I really do believe acupuncture improves pregnancy rates if one is transferring a chromosomally normal healthy embryo. We can't say that definitively because that study has not yet been done. But if you don't have a needle phobia and you can afford to do acupuncture, I really think it's worth it to do it pre and post at a minimum. And one of the reasons I say that is in the study that I did, we actually asked all the patients, we asked the patients who got acupuncture, if you don't get pregnant this cycle, would you want to do acupuncture next cycle? And the vast majority of them said yes, they would want to do acupuncture in next cycle. And when we asked the control group who didn't get acupuncture, would you want to get acupuncture? They almost all said yes as well. So I think it's a relatively inexpensive, in my mind, highly enjoyable intervention that I think has the potential, not the science yet, but the potential to improve pregnancy rates. Next slide, please.
Yeah, so these are thank you, Allie. And it's, even in my 22 years of clinical practice, it is in one city, one, setting. And I really enjoy hearing about your background, because you have a take on it that very many people in the industry, whether it's acupuncture or not, really don't have access to. So it's based on experience too, which I think is key. So yeah, thank you for that. So, what are you looking for? Obviously, myself, some of the acupuncturists that I work with in the Edmonton and greater area who I've vetted. Um, not everybody is going to be able to get access to us, and you don't need to. There are many skilled practitioners around the world, but just like you would um, look for a certain type of psychologist or perhaps doctor, teacher or dentist. You really want to just to spend a little bit of time researching, asking questions, calling or emailing, but you want to have a piece of this just be beyond the acupuncture. Um, I personally do not run numerous rooms. I know that when it comes to on-site treatments, that is no problem. But when you're having long-term acupuncture, I really enjoy spending a lot of time. I know there are other practitioners that run numerous rooms and they have a different style. They still have great outcomes. But I'm really kind of in it for the long haul. I want to be able to support you up until your pregnancy, and then you have all the skills that will carry you through that and beyond. So time spent in the treatment room, the education piece, the storytelling, and really just the trust piece, being able to tell your practitioner, no, I don't like this, or this isn't working for me. Because oftentimes patients are scared to really convey how they're feeling for a fear of maybe not being treated appropriately by whatever practitioner is out there. So oftentimes for myself, I don't see people once a week, once every 2 weeks. It's, once every 3 weeks. And why that's important to me is that I feel like it's not just the acupuncture that is supporting you. It's your ability to take some of that information that you've been given in the treatment room and execute it in your own life and really show yourself that beyond the ailment or the imbalance or what you're trying to support, that you are really caring for yourself again. And that's a piece that can be missing for a lot of people. Not trying to fix, trying to care for yourself again. So that's my final piece. I don't know what the next slide is. Allie, do you have anything to add?
No, I don't. No, I
Okay.
think I would, we only have, what, 15 minutes left. And so I would love for Monica to open it up for questions.
Okay. Hi, I'm back. So we do have a couple of questions.
By the way,
Um,
can you give instructions to people how to pose questions?
yes, absolutely. So near the bottom, you should see an icon, and on the icon, you do have a Q&A. It has a question mark on there, and that is where you can submit any questions that you may have. One of the questions that we have is, will this webinar be recorded? Yes, it was recorded, and as long as you registered, which of course you did, then you will be getting the recording, so you can watch at later on and rewatch if you would like. And one of the other questions that we did receive is, can the touch be done through different strategies like cupping, suction needles? Not sure if that is the correct name for that technique.
Okay. So so those are other modalities that I guess we would use in Chinese medicine. Cupping is one of them. So that helps move the circulation, similar to massage, but nothing really ever compares to that of a touch of a hand. And so the touch of a hand is very powerful. So I would say if um if you can find a practitioner that can really incorporate the touch piece as well, because Chinese medicine, the way it is taught, we do learn pharmacology, microbiology, all the Western pieces, but in Chinese medicine, acupuncture just one of the modalities. Cupping is one, and there's something called Tui Na, which is essentially a massage, a type of massage, but you really want to have that tactile response. And I would say most people, when they're looking for care, beyond conversational, are really innately looking for touch as well.
All right. And if you do treatments immediately before transfers, do the needles stay in during the transfer or are they removed?
Okay. Yeah, good question. So they are removed. Sometimes we will place what's called an ear seed. So whether that's a little magnet or a little roasted seed in there to place pressure on the ears that haven't punctured the skin. But the needles are removed before the transfer. And then you would, if that's the way the clinic is set up, you would come after and receive acupuncture needles again or just your pre-transfer.
Yeah, we definitely in a clinic do not want patients walking around with needles in
No.
their bodies.
Yeah. Yeah. Lots of pokey toes. You never
Yeah,
know where they fly.
yeah.
Yeah.
Yep.
Okay.
And we have also, will the PowerPoint be sent to access links? So I know that we did include a couple of links in there. I don't believe that we can put do an attachment in the email that is automatically sent, but I will try to work some magic and add that under the resources tab to make sure that those links are included in there. So I will try to see what can be done to send those links to you, of course.
Okay. Fantastic.
Any
Okay.
questions? Monica, are we?
Um, Here we have another question. We would like to know what would be a good control group when doing acupuncture for fertility treatment, and that is a question directed to Dr. Domar.
Yeah, it's because I'm the nerd. What would be a good control group? I mean, as I said, what Paulus did was he had women either lie quietly for 25 minutes with acupuncture needles in or lie quietly without acupuncture needles in. And so there's been a lot of research using what they call sham acupuncture, where you can actually get these what look like acupuncture needles and you put them on the skin and it touches the skin, but it doesn't actually penetrate like an acupuncture needle does. But the problem is most acupuncturists will say simply having a needle touch the skin may have a therapeutic effect. And so these sham needles, as far as I know, and Sabrina, you can contradict me, as far as I know, the acupuncture community has dismissed these sham needles as being, not a really effective control group. I mean, I guess a good study might be to compare, true acupuncture to sham acupuncture to nothing. And I think there actually had been a couple studies that have done that, and they have found, as people figure, that there was some effect to the sham acupuncture. Again, I think, until we do a study which only includes PGT tested embryos, we're not going to be able to definitively say anything. But given that the research shows that women who do get acupuncture pre and post find it very relaxing, they really enjoy it, it lowers their anxiety levels, and they say they would do it again if they had to cycle again. Again, I'm a big proponent, personally and professionally.
Yeah, yeah, I second that piece with the sham. Yes, most acupuncturists, including myself, any kind of touch on the skin creates a biochemical response.
Yeah.
Yeah.
It's just not an accurate control.
And next question that we have is, where do the needles usually go on average, or at least for beginners? And I
Okay.
think that's meant
So
as
I
in
see Shelby, there's two questions. How is acupuncture different from dry needling? And where do the acupuncture needles usually go on average or for beginners? So dry needling is another version of what acupuncture is. It is physiotherapists will use that often that coined term, and it's still the use of acupuncture needles. They just tend to be a little bit thicker and a little bit longer, and oftentimes they are used for really musculoskeletal issues. So you're really looking for a physical response from that. Some traditional Chinese medicine acupuncturists will also utilize that technique, but it's called acupuncture under our scope. So the dry needling is more so from more of a physical, musculoskeletal, like a physiotherapist. So you would be looking for acupuncture essentially. And then as far as um, where you would place the needles. I know this is such a blanket statement, but it's the truth. Everyone, besides transfers, everyone is different. So oftentimes you will have a few placed on your back and then a few placed on the front of the body. So it's not only about where the ailment or seemingly imbalance is. We want to take a look at nervous system, circulatory, lymphatic, and then endocrine system.
Perfect. And we have another question. Is acupuncture for transfers offered at all clinics?
No, for Inception Prelude clinics, no, it's not. I wish it was, and we're rolling out this month having an embedded psychologist in our first clinic, and that's right now what I'm working on is going to have embedded psychologists in all of our clinics, hopefully by year end, and then we can start working on acupuncture. I think most of our clinics have a relationship with an acupuncturist, just like PCRM does with Sabrina. And so if you are a patient at one of the Prelude clinics, you can ask for the list of the local acupuncturists that they recommend, because you want an acupuncturist, as Sabrina said, who understands infertility and understands reproductive medicine and understands what an IVF cycle is.
And I know that there is a question on there regarding what website you can go on to be informed of the incoming webinars regarding IVF. So I am going to include on there the link to our hub for Prelude, and that will have all of the upcoming webinars.
Yeah, I do at least one a month.
Right, and I will see if we have any others. So, is it normal for some acupuncture points to feel more heavy and sore, or does that mean that the needle was inputted too deep?
It is so everybody's nervous system is different. So if you're in a really big state of tension, your acupuncturist should be able to tell that through just touching you, talking to you, your pulses. So those points should be quite shallow and they'll have a fantastic effect. If they are, if you have one once in a while that's feeling sore, that's okay. But if you have, a sore points every treatment, I would say definitely the treatments are probably too aggressive for you. So you need a shallower style. Um, and if you really enjoy your acupuncturist, I would venture to say, have that conversation with them. To say, hey, could we maybe take a look at doing this a little bit more of a shallow technique? So in Chinese medicine, we call it a Japanese style. And all acupuncturists should know how to do that at a little bit of a more superficial level. And you can go from there. But yes, having a sore point once in a blue moon is okay, but not every treatment, certainly not.
So being the nerd, I can tell you that the research shows that there is a complication in 1 out of 80,000 sessions. Now, if any surgeon could say that they had a complication rate of 1 in 80,000, they'd be the best surgeon in the world. So it's a very, very safe intervention.
Hmm. Ali, I need you in my back pocket all the time.
It's really
You're my
funny.
Google.
It's,
You're my Google.
I've written a couple apps with a colleague of mine who's sort of has my job at Cornell. Her name is Liz Grill, and every time she needs to be able to cite a statistic, she'll call, text, or email me and say, "Just cite that study for me, or give me those numbers." I'm a lot of fun at cocktail parties.
Yeah, no kidding.
I'm a research. I mean, I'm a clinician. I'm a psychologist. I still see private practice patients, but I do remember my research. So I think we're almost out of time, Monica. Do we have one more question?
We have one last question. How often do you recommend patients get acupuncture treatment to improve fertility, once a week or once every 2 weeks?
So like I had mentioned before, everyone has a different style. My treatment style, there's a lot of education, and so there's other pieces that patients are doing outside of the treatment room that are really effective. And so sometimes if you're going for consistent treatments and it's just the needles, it can be a little bit of a band-aid treatment where you're not really receiving holistic care. So for myself personally, I do not see people once a week unless it's something really critical and there's something going on with pain response. So, if you receive all parts of that care that I was talking about earlier, every 2, 3 weeks is more than sufficient.
Yeah,
Ali, I don't know about your experience.
I would say actually, when I look back at the acupuncturists I worked with for 20 years, each one of them, of the 5 or 6, we even had a husband and wife team from China. They each had a very individual style. And for example, one of the acupuncturists who was a Western trained Chinese physician, there were times where she would see patients 2 or 3 times in 1 week, in like a week after their transfer. So, the thing with acupuncture, and Sabrina and I were talking about this earlier, you know, most acupuncturists feel like it's a travesty to do research the way we have to do research in Western medicine, which is a randomized controlled trial, where every patient gets the exact same form of acupuncture. Because the art of acupuncture is that every patient is treated individually, and you can't really do research that way.
Well said. Very well said.
So I want to thank you very much, Sabrina, for taking your time this evening to educate everybody. I did not know 98% of the physiology of all that you've been talking about, and so I learned something tonight. And I appreciate everybody who joined the webinar, and especially Monica, who covered for Arena tonight. Thank you for taking your evening to do this.
I'm happy
Yes.
to.
Yeah, thank you very much, Monica. And yeah, Ali, if I could have you on every webinar, I would just love it to bits. I really, oftentimes it's just myself, and I really enjoyed this process. So I really hope there was a lot of value for everybody listening and everyone that will be listening. Um, so thanks for attending and thanks for having me.
Our pleasure. Thank you, everybody. Good night.
Thank you.
Okay, good night.